Thanks everybody for joining us here today. The session's entitled Case Study, Medical Legal Partnerships in Texas Healthcare. Building on last week's introduction to medical legal partnerships, today's session explores how healthcare providers navigate the decision to adopt this health law model of patient care. We'll hear real-world examples to explore key factors that shape MLP implementation, including organizational priorities and patient needs and community resources. If you're considering whether an MLP is right for you, this webinar will provide valuable insights to help you make informed decisions. The session's moderated by Keegan Warren. She's the Executive Director of Texas A&M University's new Institute on Healthcare Access. She brings lived experience and a civil justice lens to health and wellness, specializing in non-medical cost drivers and health equity. She is an attorney and federally qualified health center director with nearly 2 decades of senior management experience spanning health and human services. Last week, Keegan introduced MLP work and why they are gaining traction in federal and Texas health policies and whether this approach could benefit your practice, organization, or patients. If you missed the section, we encourage you to view it for additional information. To introduce our case studies today and our speakers, I'm going to turn it over to you, Keegan.
Thank you, Charles. And I want to echo both you and Jackie and thank everyone for joining us today. Jackie, can we maybe share slides? So in our thank you so much. In our previous session, we laid the groundwork by examining the essential blueprints before the build, if you will, the pre-implementation strategies that really set the stage for an impactful, effective, and sustainable MLP adoption. Let's go and go to the next slide. We began by considering the real-life scenario of Ms. Smith, a pregnant patient facing food insecurity due to denied benefits. And her story highlighted how unmet legal needs can directly harm health and how a coordinated response, in this case, a midwife connecting her with an embedded legal expert, how that can help rapidly resolve issues and improve outcomes. In her case, it took just 7 days of that legal intervention for Ms. Smith to regain access to vital food benefits, and in a way that is connected to the health outcomes, to the reason that we asked that question to begin with, right? This really underscores the power of integrating legal care into the healthcare setting. So for those of you that are new to medical partnership, a bit of level setting. What even is a medical legal partnership? Well, medical legal partnership, or MLP, is a healthcare delivery model that embeds lawyers as specialist members of the healthcare team. Those lawyers work alongside clinicians to address the non-medical drivers of health, things like income or housing, education and employment, personal stability, these areas that often underlie poor health outcomes and frankly drive avoidable costs for the healthcare systems. Now, importantly, MLP, unlike a traditional referral network, requires closing the loop, meaning we're reporting both outcomes and outputs, and that we really want to ensure that legal interventions are fully integrated into all aspects of patient care. Now, the evidence is clear, and I gave you lots of it. This is an evidence-based, systematized approach. It does improve health outcomes from pediatrics to adult medicine across a variety of all conditions, asthma, diabetes, mental health, and so much more. MLP participants, patients, and importantly, are much more likely to actually access services in this setting and to share the full social history that's relevant to their care with their providers. So we concluded with a discussion of practical implementation, how clinicians and attorneys can advocate for their patients within care delivery, how organizations can align their MLP with internal strategies and with national priorities, and how you can assess readiness and resources for building a sustainable partnership. We also talked about the national bodies, the American Academy of Pediatrics, the American Medical Association, the American Hospital Association, and their recognition and endorsement of this model because it improves health outcomes and because it enhances community well-being. So we're going to build on that foundation today. We're going to discuss actionable steps for integrating legal care into your practice, for examining organizational considerations, for sharing tools that help teams operate at the top of their license, and that ultimately ensure that every patient's health-harming legal need is addressed as part of comprehensive, high-quality care. Today, we welcome two teams, population health professionals, evaluators from two existing medical legal partnerships who will firsthand share their insights and experiences. They will provide valuable perspectives on how MLPs function in different settings, challenges that they've overcome, and measurable impacts that they've achieved for their patients and communities. So with that introduction, I'm going to turn it over to attorney Susan Soto and the Access Health team for our first case study. Susan?
Thanks, Keegan. Good morning, everyone. I'm so excited to share with you today our story of how we address the non-medical determinants of health through our medical legal partnership. I'll invite my two teammates to unmute and introduce themselves. And as Keegan said, I'm Susan Soto. I'm the staff attorney for the program.
And hello, good morning. My name is Darcy Moore. I'm a population health program manager at AccessHealth.
Good morning, everybody. My name is Carol Luna. I am the lead community health worker here for AccessHealth Clinic.
Slide.
All right, so today we are going to share with you how AccessHealth as an organization, we are committed to non-medical drivers of health. We'll talk about unmet legal needs and the relationship between the health outcomes of patients. And we will share a lot with you about the lessons we learned developing and implementing an MLP into our health center. And then, of course, looking ahead. Next slide. So why should a health center invest now? So here is our why. These are a few quotes from some of our patients that have gone through our MLP program. And this is why we do it. If our patients can be feeling more empowered and more confident walking out of our clinic, that is what our goal is. Next slide. So Access Health, we are a not-for-profit, federally qualified health center, an FQHC. We are located, we have 5 sites in Fort Bend County and 1 in Waller County. We are the largest provider of safety net services in Fort Bend County. So we're just outside of Houston. And as you'll see, many of our patients are uninsured, so we do not turn anybody away. We accept everybody regardless of insurance status or ability to pay. So we have a sliding fee scale, and we are focused on making healthcare affordable and accessible. Next slide, please. So Access Health is an integrated care system. And basically what that means is we are focused on providing wraparound services. So the idea is that a family, an individual can come to Access Health, become a patient, and have many of their needs met in one place. In addition to all of the healthcare services we provide, we are also, as an organization, committed to addressing those non-medical factors too. All right, everybody here, I'm sure could agree that patient health outcomes are impacted by so much more than access to clinical care and the quality of that care. So as an organization, we have to address all of those factors to ensure the best possible health outcomes for our patients. Next slide, please. So how did we begin setting up an MLP at Access Health? Well, in 2018, during our back to school annual health fairs, we conducted a community needs assessment among attendees. And legal needs were highly requested. We realized that was a huge concern among our patients. So our leadership decided to attend a MLP Learning Collaborative in Harris County in Houston. And that is where our leadership learned about Houston volunteer lawyers. They already had an existing MLP with Texas Children's Hospital. And so our leadership decided to begin the conversation with HVL around potentially establishing that pro bono model out in Fort Bend County. And they were willing to expand. So next slide, please. So in 2021, Access Health has secured funding to begin an MLP, and we set our pilot to run from August to December of 2021. During that time, Houston Volunteer Lawyers, or HVL, was working to train our Access Health staff. Next slide. And so in 2021, our social needs screeners identified that 26% of the patients surveyed had legal concerns. And the greatest areas around concerns were regarding immigration, traffic tickets, housing, and guardianship. And so during that pilot stage, we referred patients over to HVL, over to Houston Volunteer Lawyers. And then we also held in-house education series among different topics. So by 2023, Access Health reached out to HVL to potentially secure a attorney that could be housed in our clinics. And so we posted that position in fall of 2023, and it was a long process to find a good fit because this attorney needed to be connected to Fort Bend County. It was important that they had the ability to work somewhat independently, and it was very important that they were bilingual and they spoke Spanish because many of our patients are Spanish speaking. And like I said before, it was a long process and we did not find a viable candidate in 2023, but in 2024, we resumed interviews and we found Susan, our perfect fit, in April, and she was onboarded officially in May. And so it has officially been almost, well, today it's been a year. And now I'll pass it over to Susan to talk about our legal aid provider.
Thanks, Darcy. I would like to share with the audience a little bit more about Houston Volunteer Lawyers. Primarily, there are two models of legal aid. There is a direct service model where the staff attorneys who are employed by the legal aid organization actually provide the legal representation to the clients. And then there's the pro bono model. Houston Volunteer Lawyers uses the pro bono model where we rely on a bank of volunteer attorneys across the Houston area who, when their dockets and their schedules allow, will view our waiting list and will take our clients' cases free of charge. By benefiting from the large number of volunteer attorneys across the Houston area, we're able to help many more people using that pro bono model. Of course, there are eligibility requirements for being eligible for full legal representation. And we also provide other services at Houston Volunteer Lawyers, including phone clinics that we call legal lines. We have legal lines just about 3 times a week, in the evening a couple of nights, and then during the day on Fridays. We host in-person clinics for our clients, and then of course that full legal representation. Next slide.
All right, so during our pilot stage, pretty much the programs, the entities were operating independently. There wasn't a lot of coordination between us and Houston Volunteer Lawyers. We, of course, did not have that dedicated attorney in-house, and we were not able to update our patients' electronic medical records. So there wasn't a lot of, because of there not a lot of coordination, we couldn't find out the results of the process and then be able to update their provider. So we're calling year 1, this official year, having Susan in-house, and this is our new MLP. And so what we have learned is that collaboration and communication between the two entities is absolutely important. Whether that's, quarterly check-ins, monthly check-ins, or just having good communication, very important. Of course, you have to plan the level of access your attorney will have to electronic medical records. That's been a big challenge for us. With electronic medical records comes a lot of security and HIPAA concern. So will your attorney be able to access your patient's medical records? That's a conversation to have. Of course, evaluating where your attorney will sit and will meet with patients one-on-one. They have to have a private, secure space. And so, we were lucky to be able to have that space at our largest clinic, Richmond, but that is a challenge at some of the smaller clinics. So you kind of have to be able to pivot. And then, of course, budgeting, thinking about needs beyond salary and benefits, but also, other monetary needs for the program. Thinking about that at the beginning is important. And now I'll pass it to Carol to talk about how she is so important to this process.
Thank you. Good morning, everybody. So as a community health worker, I feel like my perspective on how do we make our MLP program work is that we continue to make our clinic rounds. We continue to train our staff as well as our providers on the importance of having our medical legal program here and an in-house staff attorney. We continue to remind them to please continue to send referrals on any patients that are needing any medical legal needs when discussed in the exam rooms. And as well as for me to continue to be the liaison, patient liaison between the providers as well as the patients to help coordinate the care for our patients to make sure that we're addressing any type of needs that has been done by our patients. And how do we put these pieces together to make our medical legal program work as well as our non-determinants of medical health survey and the value of our patients? Well, what we do is here is every 90 days, a patient is given a screener. And in that screener, we have various questions that is being asked for our patients, such as any education, employment, transportation, housing, utilities, and as well as legal needs and access to foods. So once a patient has marked off the survey of those needs, then as a care coordination department, we get flagged of these needs. And our community health workers and navigators will contact the patient to educate them on the resources and to send the appropriate referrals to within our referrals within our outside organizations or within our organizations to help address these needs.
So let's talk a little bit more about those needs. Keegan reminded us of an example of a pregnant mother and how she can be served through a medical legal partnership. And both of our entities, both Houston Volunteer Lawyers and Access Health, are committed to the idea that unmet legal needs are health harming legal needs. I've got some other examples listed on the slide here of legal issues that, if they're unmet, will have health consequences. When we look at landlord-tenant issues, of course, we want to prevent patients from becoming homeless, which is a huge impact on someone's health, but also we're concerned about environmental legal issues. For example, if a landlord is refusing to remediate mold in a rental unit. Also, child custody issues, an extremely serious legal issue. Not only can those issues cause anxiety and depression in the parents as they're working through these legal issues, but if that stress filters down to the children, we could even be looking at some developmental issues with the children who are embroiled in this custody dispute. And then finally, if there's been an interruption of income of some kind, we can certainly look to lift every patient out of poverty if they're facing poverty. And by helping them replace some of their financial resources, we can even help them access healthier food by increasing the income that comes into their household on a monthly basis. Next slide. So how are we doing that? Well, these are actual legal issues that have come through our MLP in the last year. Of course, we've had the standard family law issues like divorce, child support, and child custody. We have had landlord-tenant issues. We've done several alternatives to guardianship for disabled adult children. And we held an extremely successful wills clinic in the fall, where 14 patients walked away with completely executed estate planning packages so that their families will be taken care of in the future and the patient's wishes will be followed. Next slide. So today we're delivering all of those services in those different legal areas through my presence here at the Richmond Clinic. And I also do travel to the other 5 clinics to meet patients if they're not able to come to Richmond. We do hold legal clinics. We do a lot of estate planning here, and Houston Volunteer Lawyers also provides a naturalization clinic every other month. and our patients have been referred to those clinics as well. Of course, I mentioned earlier our phone advice and counsel clinics with volunteer attorneys, and some of our patients are funneled to either legal lines or consejos legales. We give group presentations to patients and to community partners, not only telling them about the medical legal partnership, but doing some legal education as well. I'm finding that lately, promoting these events as Know Your Rights seems to be a little bit too legal. And so we're talking now about just legal education and making presentations on different legal topics. And then, of course, we continue to market the program to AccessHealth patients so that they know this is one of the other wraparound services that is available to them here at the clinic. Next slide. This is my favorite. So how are we doing? Well, last year, between January and the end of April, Carol referred 20 individuals to Houston Volunteer Lawyers. But remember, that was a one-way pipeline. When I came on board in May, until the end of 2024, in that time span, we served over 100 patients with either advice and counsel or full representation. We had over 20 patients last year who were picked up by volunteer attorneys right off the bat in the early stages of the program. What do we see coming up? Well, if this first quarter of 2025 is any indication, those patient needs are not slowing down. You can see on the slide that we've served over 70 patients in the first quarter of 2025. So the need is continuing to grow. Next slide. So we do have some goals for the MLP, and we're looking ahead, even though in May now we're celebrating our 1-year anniversary of formalizing the MLP. We've got more to do. What do I have to do? Well, as you saw from the numbers slide, the need is growing, and so I've got to grow the pro bono attorney network here in Fort Bend County. We are the first medical legal partnership in Fort Bend County, and pro bono legal work is really not on the radar of attorneys out in this area. So I'm working hard and will continue to work hard to build that pro bono network where our clinics are located. I'm also excited that we have partnered with Texas ILC to have a legal access fellow under a 2-year grant. And we're hoping that this fellow will be on board sometime this summer, and she'll be able to help us also increase program capacity with immigrants, but not with immigration issues. And as you saw from the legal topics slide, we have a lot. Carol.
Yes, and we will continue to offer legal learning opportunities for our patients as our medical legal partnership program continues to grow within our clinic and in Fort Bend County area. We will continue to offer legal education series, wills clinics, and continue to educate our staff as well as our patients of our medical legal partnership program for our patients.
And we have began launching pre-surveys, and now we're in the post-survey stage of tracking the impacts of our MLP on our patients' health outcomes. But, we want to continue to talk about evaluation and how we can translate our patients' stories into meaningful data to really show the impact that we're having.
And our final slide is our thank you. So here's our contact information, and if you would like to scan the QR code and stay in touch, we are launching in the near future an MLP newsletter to continue to tell our story. So Keegan, I'll give it back to you. Thanks for the opportunity.
Thank you so much, Susan, Darcy, and Carol. It's really wonderful to hear how much you've accomplished in just 1 short year. I think it's also really important to lift up some of those questions that you all had to answer early on. which are things like space, right? Where is the lawyer going to sit? You have to have a private space, right, Susan, to do your work. And EHR access, that is a major one. And it unlocks so many opportunities to close the loop and to really get at sustainability. And so I think those are two great questions and two really important takeaways for everyone who's watching. We're going to turn it over now to a very different program that is a little bit further along in their implementation and a lot larger. And the idea here really is to offer to folks who are watching a contrast between a partially relatively rural county and a smaller program that's only a year in, to a program that, as you're going to hear, spans multiple states and is a little bit further in, as I mentioned. So with that brief introduction, find themes. This may not map exactly to your experience, but that's okay. I want you to think about the themes. What are the lessons and what does this incredible evaluation work tell you about your pre-implementation strategies? Sheridan, Charles, may I turn it over to you?
Thank
Shane.
you.
Shane. I have never named. I'm reading the looking at the wrong name. So sorry. Sheridan and Shane.
No worries. Hi, everyone. I'm Sheridan Green. I'm a researcher at Kaiser Permanente, Colorado, the Institute for Health Research. And we were leading the medical legal partnership evaluation here at Kaiser Permanente, Colorado. And we can go to the next slide. We've got some fancy pictures of us there. And I'll pass it to Shane to introduce himself.
Thanks so much, Sheridan. My name is Shane Mueller. I'm also a researcher working closely with Sheridan on this initiative, helping manage the evaluation project.
Thanks, Shane. Kaiser Permanente, that's right, you could switch, please. Thank you. Kaiser Permanente's Medical Legal Partnership Initiative directly tackles eviction risk and housing instability for Kaiser Permanente patients. The initiative was launched in by our Kaiser Permanente National Community Office of Community Health with assistance from the National Center for Medical Legal Partnership and Health Begins. Kaiser Permanente targeted their investment in this healthcare system community partnership, and it has resulted in some resoundingly positive outcomes and some key lessons learned that we'd like to share with you today. Next, please. So you can see in 22 to 24, 5 Kaiser Permanente regions implementing the MLP model as part of our initiative participated in our evaluation. The Peer Center at the Institute for Health Research at Kaiser Permanente, Colorado, designed and conducted a cross-site evaluation with consistent outcomes and measures across participating regions. We did this through surveys and administrative data, and we examined the MLP reach, the effectiveness for the participants, as well as some health system outcomes. Next, please. We had many lessons learned that we want to share with you. You can go to the next one too. But I always like to start with a quote because this really grounds us in the work, and I'll voice this for us. Every few days, they'd have an eviction notice on the door, which is embarrassing, you know, but all the things they were doing, it did get to my health. I'm still being treated for high blood pressure because that's when it all started. Now I feel like I'm able to go to the doctor more because I'm not worried that I'm going to come home and there'll be an eviction notice on my door again. Get to the next one. So we had some critical learnings from early setup and implementation of this MLP evaluation program partnership that we wanted to share. There are some important considerations around gaining evaluation buy-in and adequate funding and staffing resources for evaluation from the outset. And I think that really means that it's important to be clear about resources and funding for the evaluation, including planning for, including money for planning and collaboration, which necessitates that you would be a partner from the beginning. I think there are ways that we can identify how the evaluation team can support the collaboration and early and ongoing impact on the program workflow and where evaluation fits in. It's also important to consider your evaluators as a really important part of the MLP partnership. So I think also in terms of setting up clear expectations for that partnership is critical. And that means having agreement on the evaluation questions to address, timelines, data sharing agreements, and written data pathways. I'm going to talk a little bit about the data sharing agreement, data use and sharing agreement piece, because that could also need to be very much at the beginning as part of the contracting and setting up those communication structures and tools early on are really important for the whole project and are really critical for evaluation data collection. Agreeing on, I'm still on the other slide. Sorry, I keep blabbing. You want to turn it back to one slide? Thanks. Looking forward to the end is also really important because you want to set up your evaluation and ask the questions that are meaningful to get you the answers that you need at the end. So that means you're building that shared expectation about what you'll need to know by the end, especially around policy, program, and system improvements. Another piece about setting up those clear expectations is thinking about closing the data loop, meaning, if it's an MLP, when you have that system that is feeding back what happened with people, what follow-up might be needed. The MLP partners need to have mutual accountability for any remaining participant needs. So just recognizing how complex participant issues are, they often go beyond the legal issue. And so, comprehensive resource referral is great. Anyway, communication tools, that's the final quadrant over there on the bottom right-hand side. Don't underestimate the time it takes to set up intentional, well-functioning platforms for data sharing and communication. Effective, efficient communication is essential, and it takes a lot of thought into what tools are needed to optimize collaboration. Next slide, please. So this just gives you a sense about what kind of thing, why are we evaluating? Why is it an important part of the collaboration? And evaluation really provides a great ongoing way to support organizational and collaborative learning at important inflection points during the program. And it helps us understand if we're on track reaching the patients who most need assistance and whether we actually help them reach those positive and desired outcomes. And next, I'll pass this on to my colleague, Dr. Mueller. Thank you.
Thanks so much. You can go to the next slide. Perfect. This is great. Yeah, I'm excited to share some results from the evaluation that we've conducted across all these different states for a few years now. It's really exciting, obviously, to see these results, and I think it's a byproduct of a lot of the work that Sheridan just described that goes into setting up an evaluation. It is exciting with these results. They can be used in so many different ways. They really help provide feedback to the program to see how things can be improved or changed. The results of these evaluations can inform policy and really help you understand kind of the return on investing so much time and money into these programs, kind of what the results are. So I'll go ahead and share some of those now. So I'll be presenting on results of data that go through July 2024. The medical legal partnerships have continued since then, but these results are from that time period. So we were excited to share that over 1,300 legal referrals were made on behalf of 1,200 unique Kaiser Permanente members or patients. And we are aware of 789 cases that have been opened by our legal providers working with these patients and members, and that 707 of those cases have been closed. We did go ahead and estimate just how many members in the household were also helped through these legal services. So we know that over 2,400 members we estimate were reached by this initiative through these referrals. You can go to the next slide. And so Sheridan alluded to kind of this data feedback loop. We have some of that data, unique data, identifiable data for 535 unique members. And that's data that's shared back to us from these different legal providers. And when we think about the different needs that are addressed through these legal services, a lot of them are primarily related to housing and utilities. Some of them are related to income and insurance. And then we also saw a few cases related to education and employment, legal status, or personal and family stability. You can go to the next slide. So legal services were effective at closing cases with meaningful case outcomes more often than not. Most closed legal cases only involved light touch services, such as things like counsel and advice, while a small proportion of these cases required more extensive services. This kind of just suggests that most legal needs that come through the MLP can actually be addressed with minimal intervention. Yep, so you can see the numbers there on just the light touch services provided. I'll also comment that the majority of these services were also closed with less than 5 hours of service. So many of these cases really can be addressed with limited time. Go to the next slide. So in addition to hearing back from our legal teams, we also talked directly with participants. We did some of the surveys, and then we also did some qualitative interviews, and I'll be providing some of these results as well. One thing that we asked about to these participants was their understanding of their legal rights. And through this program, participants reported that their connection to legal services really improved their understanding of legal rights and self-advocacy. One participant shared back with us, our attorney had told us so much that we were able to handle the case ourselves in court. Even the judge was saying, "You negotiated this yourself. You've done better than a lot of other people would have." And so our attorney gave us some very good advice. Go to the next slide. We also heard from participants that Kaiser Permanente healthcare and provider satisfaction remained high through this whole process. One participant shared that, "I've been reaching out to KP more for help, and at first when I felt like helpless, I feel like now that I'm getting more help. My primary care doctor really helped me regulate, and my pain level, where before I was like out of 8 or 9, now I'm like, I would say like a 5 or 6, like my pain level is more manageable." Go to the next slide. We heard from a lot of participants that their involvement with the medical legal partnership really improved their housing quality and stability through this process. One participant shared, "We were able to move. There's no eviction or anything like that on our credit or anything, nothing." Another shared, "It was embarrassing because where we were, I couldn't go up and down the stairs to shower. Kaiser helped us move, and now I can shower, and now I can move around. Now I have a nice home for my children to play in, the front or the backyard." And finally, we talked with a lot of participants about improvements in their physical and mental health. One participant shared that, "At the time of my legal issue was going on, I really had a hard time with my health. There were some days I wouldn't want to get out of bed or couldn't get out of bed. My weight went down to 115 because I was stressed. I wasn't eating or anything, and now my weight is back to normal. While it was 115, if I would have gotten called for a transplant, I wouldn't get it because you have to have a minimum weight of 130. But when I got out of that apartment and all the stress about it, I started to get better." So these are just some of the participant outcomes that we heard talking to some of our members and patients that had been through the medical legal partnership services. So on to our last evaluation set of questions that we asked. We were really interested in understanding the impact of medical legal partnerships on utilization in our healthcare system. So we looked at both, emergency department visits. We looked at both in the 6 months prior and the 6 months post the medical legal intervention, as well as 12 months prior and 12 months post. And then we also looked at changes over time, both among the group of participants we know were referred to receive legal services, as well as those that we could link back to their medical record that we know had a case opened. So on average, ED visits per person decreased 9% over time for those people who were referred in the 6 months before and 6 months after. And that reduction was 2% for those who had a legal case open. When we think about it in the 12-month ED visits, we saw a reduction of 11% among those who were referred, and a reduction of 10% in ED visits among those who had a case open. We can go to the next slide. We also looked at hospitalizations among participants and those who were referred and those who had a case open in the 6 months prior and 6 months post, as well as in the 12-month time period. This was really exciting. We saw average hospitalizations decrease by 20% for the referred group in 6 months post the medical legal intervention, and that reduction was even larger, 38% among those who had a case open. We saw a similar pattern in 12 months as well. Average hospitalizations decreased 12% among those who were referred, and 32% among those who had an open legal case. So we were really excited to see the reach of this entire intervention. This medical legal partnership served really diverse demographic, reached a lot of people. We saw impact, across a wide variety of legal issues, and our participants really reported a large impact in their lives. And it was really exciting at the end of this to see, really changes in the way that our patients were interacting with the healthcare system. So we're excited to continue with this evaluation and hopefully learn more as we go. So thank you all. Keegan, I'll turn it back to you.
Thank you, Sheridan and Shane. What an incredible set of stories from interviews, and the data analysis is just absolutely top notch. I would love for folks to put any questions they have, comments in the chat. We're happy to unmute. Otherwise, I want to do two things. Well, one, I want to remind everyone that the Texas Medical Legal Partnership Coalition exists as a professional association, not to provide direct services, but really to support you as you are implementing MLP, and as you are continuing, as it's an ongoing process. You can get connected online. We do have a free newsletter. There's no membership fee associated with joining, and the annual member meeting and conference is in about a week and a half. So registration is still open, I think, through today. There may be some ops folks who tell me I shouldn't be saying this at this point, but please register and attend. The other really great resource for folks is the National Center for Medical Legal Partnership newsletter. So we have one question in the chat, and Charles, I'll invite you if you want to join me as well in engaging our panelists in conversation. The question in the chat is for Susan and her team, and it asks about the legal avenues available to an MLP in Texas to force a landlord to do a home remediation because of asthma, and if you can discuss successes and challenges on this issue. So just generally, what are the connections between our state laws on habitability and how does that connect to asthma health outcomes?
Sure. So the beginning of this particular loop would come from a provider alerting either Carol through the health record system, or myself. That's the beauty of having me on site. I do communicate regularly. And then once I've had a consultation, certainly an interview with the patient and the patient's family, if we're talking about children who are having some respiratory issues, then we look to the simple remedies that are listed in the Texas Property Code. There is a right to a tenant's repair and remedy. And so on the legal side, we would guide that patient through the process of demanding the repairs, documenting, giving the landlord a reasonable amount of time to cure those repairs. And then if not, then it goes to litigation. These are the kinds of cases that are really good for a volunteer attorney because there's a tangible result. There is a direct health related issue. And for remedy in court, if the landlord isn't fixing, let's say, the mold in the home, then they go to court, and the court can either allow that tenant to break their lease, or they'll order the landlord to fix that, because there are laws about habitability, especially for rental properties. So once either that family is allowed to break their lease without penalty and without a ding on their rental record, or the landlord remediates that mold, then the provider here at the clinic should see an improvement in that physical health, whether it be respiratory or, x-rays of the lungs or whatever the case may be. And we're all communicating with each other through that health record, through those, drive-by talks. Somebody pokes their head in my office, or I'll go out in the clinic and talk to somebody there. So that's how that would look, essentially.
Thank you for sharing that and the detail is so great there, because I think that it's easy to never have been exposed to the idea that we have a lot of law that is expressly designed to influence health. And a kiddo with asthma is just a classic example. Can I ask you a bit of a follow-up, Susan? Because we often talk about MLP only in terms of referrals. And we often talk about MLP as though medical legal partnership was just the lawyer or the paralegal, or right? We can be expansive about the legal team. But when you have a case like a child with asthma and the landlord won't remediate the mold or mildew or whatever that exacerbating factor is, how do you, or what opportunities do you see, even if you're not doing it now, to pull in the fact of the asthma and the impact of, let's say, the mold on the asthma? Do you all use medical records? How does the M in MLP work?
At this point, the M in the MLP works just for referrals and bringing problems to our attention so that we can creatively solve them. We have not yet been in court with an asthma or rental home remediation case, but I would certainly expect that would strengthen the case and would be another resource for that volunteer attorney when they're building their case.
Follow-up question on that. You said you haven't been in court, but has your team successfully compelled a landlord to do a home remediation because of asthma without going to court?
So at this point, demand letters work wonders. And even if the tenant has asked the landlord repeatedly to fix it, the landlord's not going to listen to the tenant. But a couple of times we have brought on volunteer attorneys who have sent those demand letters, and then miraculously things start moving. So that's the extent of our experience within the last year. But in the end, it's getting the problem solved.
Absolutely.
And
Thank you.
Absolutely. Yeah. And honestly, avoiding litigation is a win, right? Like that's a good thing. It's amazing how effective it is when you send a demand letter and you sign it, love your friendly lawyer and pediatrician, right? So we talk about MLP in terms of health outcomes, but I just really want to lift up that it actually improves legal outcomes as well. One of the necessary questions here is you're thinking about implementation is, why would a lawyer want to do this? Why would a legal services organization want to partner with you, right? And it's those kind of stories that are actually really important for helping them identify their pain points as well. That's what creates the magic in a partnership. Stephanie Summer Latte has noted in the comments that she may have experience that's relevant in terms of pulling the M onto the legal team, right? Not just the lawyer, the L onto the medical team. Can we ask you to unmute for a moment?
Stephanie is also with Houston Volunteer Lawyers. She's our
Indeed.
supervising attorney, and she's been working with Texas Children's Hospital MLP for many years. So yeah, chime in, Stephanie, please.
Yeah, absolutely. And Susan is absolutely right that the first step is to look to the law and to the property code and make sure that tenant has complied by giving the proper notice of repairs. That's always our first step. But the M part is the great part, in which that we've had a lot of success in getting a letter from the doctor saying this person is allergic to roaches or mold or whatever is in the apartment in those conditions. And then I move forward simultaneously making sure we have the proper repair request following the property code. And then I follow up with the reasonable accommodation letter to the landlord with that medical proof too from the doctor saying patient X is allergic to roaches, this apartment's infested with roaches. And I outline like we've sent requests, patient sent requests. And we've often are able to get that tenant out of that lease without needing any penalties, so they were able to move. So that is a good non-litigation strategy that we've used at our Texas Children's MLPs a lot of times, and it's been successful for us. With our Texas Children's MLP actually haven't had to litigate because most of the time those people went out of there too, so they're ready to move, and we've been able to be successful in doing that.
Right. Imagine if in healthcare we sought to address not just homelessness once it's happened, but to prevent it, because we're getting ahead of the ways that people get driven out of their own homes. Right. There is so much magic here, and I love how y'all described this bi-directional relationship that really lifts up the goals of both addressing non-medical drivers of health, the goals of the Legal Services Organization, and also the health impact, the goals of the healthcare organization. Are there other questions? I have lots, so. But I want to give everyone else a chance. If you want to jump in, you can put it in the chat. You can unmute. We're a small group. Let's have a conversation. All right, while you think, let's pivot to Sheridan and Shane. I'm wondering if you all you did a really great job of talking about the impact of legal interventions. First of issue spotting, right? Just being able to see a non-medical driver of health as a legal need, right? That in and of itself seems to be correlated with reductions in hospitalizations, for instance. But then actually having an intervention deepens that correlation. And we've seen that in other studies as well. So that's absolutely what we would expect. But I'm wondering if you can, and you took us a little bit down this path, Sheridan, can you unpack that a little bit and help folks kind of think in terms of, if this is our gold standard for evaluation, what does that tell us that we need set up for implementation? And is there anything you all wished? Is there anything you would have done differently? Anything you wish you had known?
Yeah, that's a great question. I'll bring my researcher lens, and I think for us, the identification early on with patients about the array of needs that they have is really critical. And so I think about those as also data collection opportunities. So when we're thinking about really high quality social health screening measures, or we're thinking about ways in which we can learn more to inform the partnership early on with patients, I think that's really helpful. Sometimes it's that clinical evaluation, but I think there are other tools that can be used for multiple purposes. I was admiring Susan and Darcy and Carol's assessment tool that they showed on their screen. I'm like, okay, what are they looking at there? I think that's so critical. And the assessment component is so critical in the beginning, the setup. And then there was another part to your question around what we wish we would have had in place in the beginning. I often feel that evaluators are kind of brought on after the fact, which is why I kind of talked about getting in on the beginning. And so it's hard to break into some of the existing workflows and have this be a parallel process with evaluation and the other workflows. So I always wish for us to be at the table at the beginning. I always wish that there's great assessment. I always wish that there are enough resources for evaluation, because there's often not. We have to try to answer really big questions and return on investment for little funding, but that's, that's a movement. We're working on that piece.
Yeah.
But I think if I were to say the one thing that was so critical is really setting up those communication structures where you would be able to ensure that the bidirectional data sharing use and agreement is really set. That we had some challenges around some of the data sharing pieces, especially because we both have come from different worlds. There's this sort of HIPAA piece and IRB with research and human subjects research. And then there's the legal piece about protecting people's privacy that is so critical. And they kind of fit together, but I think there's something interesting to explore there about best practice in those data use agreements.
Well, I hate to break off this conversation, but we are at time. I want to thank Keegan for moderating this, and AccessHealth and Kaiser Permanente for sharing their story. It's a valuable lesson to see, what's it like to start up these programs, and then what's it look like once you've got them established, and all the great data that comes out of them to support them. I just want to invite our audience, if you're not already a contributor to our program index and you have an MLP or other non-medical service in your health system, we would love to have you represented. This is a valuable resource for providers around the state to find each other and similar services, and also to demonstrate to policymakers the exciting work going on in this space. I've added in the chat a link to our program index, and if you have any questions, you can reach out to our program manager, Jackie, at jk90@rice.edu. Thank you for all for taking the time to join us today. We'll be following this up with a web link to a recording of this webinar and a brief survey for you to give us some feedback on how you think it went. With that, I'll close this out.